This is Miss Dawsett, and today I'm going to demonstrate with this video how to do an IV push. Before we get started with the demonstration, I want to cover a few things. I just want everyone to remember that when you're doing your practice in lab, as well as when you're doing your checkoff video, please do not push any kind of fluid through the IVs that you start with the mannequin arms. These arms are not made for that. So whenever you are assessing for blood return, you're just going to have to state that blood return is noted, as well as when you're assessing for patency, you're just going to have to perform the skill without pushing any fluid and state that the IV is patent. IV push refers to giving medication from a syringe directly into ongoing IV fluids or directly into the vein via saline lock. And as you can see, our mannequin arm today does have a saline lock. With an IV push, you're able to give more concentrated medications directly into the bloodstream. And it is one of the quickest and most effective ways of giving drugs to patients. However, it is also one of the fastest ways to induce adverse drug reactions. So whenever we talk about performing the 6 medication administration rights for a patient, that's one of the reasons why it's so important. When you're preparing and giving your IV push medications, you want to remember to always perform hand hygiene, disinfect medication vials, the top of them, as well as disinfect the IV access port prior to using them. Also, just a note, if you have a glass vial that you have to break open to pull the medication through, you'll need to draw that medication up with a filter needle. That helps reduce the risk of glass particles going into the syringe that you're going to inject into the patient. And of course, there are times where we have to dilute medications before giving it to the patient. You always want to reference your drug guide or the pharmacy before diluting medications to make sure that it is okay to do so. Most medications are given IV push slowly. If your drug guide does not have a time frame that you need to push the medication over, and you talk with the pharmacy and they don't have a time frame, you want to at least push it over a minute, as long as you're able to do that. In an emergency situation, that may not be an option, but pushing it slowly is err on the side of caution, and that is a better practice to have. We always want to label our syringes appropriately, especially if you draw a medication up in the med room or away from the patient's bedside. You want to make sure that your syringes and vials are labeled correctly so that the correct medication goes to the correct patient as well as the correct dose. Whenever you're given IV push medications, like we talked about, because we can induce those adverse drug reactions quickly, you want to be alert for major adverse effects such as anaphylaxis, distress, tachycardia, bradycardia, seizures. Minor adverse effects that you'll want to watch for, of course, include nausea, flushing, skin rash, or confusion. When you're ready to begin to prepare for your IV push, we're going to have to use a little bit of imagination. My desk currently is going to be the med room, and this is where we're going to prepare our medication. So of course the first step is always performing hand hygiene, washing your hands. You want to check your MAR or EMAR for the order. You want to make sure that you have every part of that order that's needed to give the medication. We want to verify that we have the correct patient on the EMAR, and also assess the patient allergies to make sure that we are not going to give them something that could cause a reaction. And we want to assess the previous times that this medication was given, if it was given, to make sure that we are giving it in the ordered time frame. From here, you're going to want to state your 6 rights of your medication administration. Of course, we've got the correct patient, route, medication, time, dose, and documentation. You will have to state these in your checkoff video to get credit for this skill. And once you've done your 6 rights, you want to take a look at whatever medication is ordered. And for the checkoff, we will have doctor's orders for you to follow. And so that goes back to your Davis Drug Guide. You're going to want to have that ready so that you can let us know what the drug action is, the common side effects, recommended dose, any contraindications, nursing assessment needed, whether prior to giving the medication and after, as well as how long to push the IV medication over. You can have your drug guide out on the bedside table during your checkoff. We do not expect you to memorize the education that goes along with your doctor's order, so you can have your Davis drug guide. If there are IV fluids currently running or other medication going through the patient's IV, you want to check compatibility with the drug ordered to be given against the IV fluids or the other medication to make sure they are compatible. Next, you will gather your medication from the Pyxis, and once again, you're going to check it against the MAR to make sure that you have the right medication, the right dose, and the correct route. From here, you want to do hand hygiene again. You'll put your gloves on. And whenever you are preparing medication, you want to prepare one patient's medication at a time. You don't want to go back and forth doing so. So once you've donned gloves, typically your vial will have a cap. So you will have to pop the cap of this vial. And it's always best practice to go ahead and scrub the hub for 20 to 30 seconds with your alcohol prep pad. And once you've done that, let it air dry. And you will open your syringe. And what you can do before you actually insert the needle into the vial, you can draw up the amount of air into your syringe that you're going to be pulling out of the vial of medication, and that will help make it a little bit easier to get the medication. So you want to remove your safety cap on your needle. Now this is very important. Whenever you are sticking your needle into the vial, you cannot pick the vial up because you're risking a needle stick. So you want to make sure that the vial is on the table or a hard surface. Then you can push your air in. Once you have this needle safely in the vial with the vial still sitting on the table, that's when you can tip the vial upside down and withdraw the amount of medication that you need. It's very important after you have withdrawn that medication. I want to show you all the safety mechanism on this syringe. They're all different. This one is a push right here. The thing is you do not want to push this with your finger. You want to take it on a solid surface and activate the safety mechanism. If for some reason during your checkoff video, if you use your finger to activate the safety mechanism, or if you put your needle in without the vial being on a solid surface and you pick it up while you're doing that, those are safety issues and you will not be successful with your video. So once you have your medication in your vial, you'll want to label it. You can put a piece of tape on it, write the medication, the dose, the route, and then you're ready to take your supplies to the bedside. You'll need to take with you, of course, your medication. You will need to take alcohol prep pads as well as saline flushes to be able to flush the medication. Okay, now that you have gathered your supplies in the med room, you want to go ahead and head to the patient's room, of course not before entering, perform hand hygiene, and then you want to don a new pair of gloves. And you want to introduce yourself to the patient and, of course, identify your patient to make sure that you have the correct patient. 2 identifiers, their name and date of birth. After you've done that, you need to assess your IV site. This is very important, and you'll need to go over this in your skills video. You want to take a look at your site to make sure that the dressing is intact. There's no redness, swelling. You ask your patient if they're having any discomfort. Our IV still looks good at this point, so we will assess further in just a moment. You can also go ahead and ask your patient if they have any allergies, again, even though we've already assessed that, just to verify. So once you've done that, you're ready to begin your medication administration. So what you want to start with is I go ahead and I get everything open so that my hands are ready to go. So of course we need to scrub the hub. So we'll do this. We're going to scrub for 30 seconds. We're going to say that's 30 seconds. You'll take your saline flush And so before we give any type of medication, we need to make sure that the IV is patent. And the way that we do that is we flush the IV. With 1 to 5 mils of saline. You'll unclamp your IV. So before we flush, we want to assess for blood return. So you will slowly pull back on the plunger. And we are noting blood return in the line. So then we will push slowly. And I will tell you guys, for your checkoff, please do not actually push any fluid into the mannequin arms. These arms are not made for that. So you will push that in slowly, and if you meet no resistance, then you're ready to give your medication. And so per our Davis Drug Guide, Lasix needs to be given 1 milliliter over 1 minute. So we need to give it over 2 minutes. And when you're given medication, you want to do the push-stop method. And the way that it is you go push, stop, and you'll need your watch to be watching the time because you want to give this over the 2 minutes. So push, stop until the medication is in. Then you want to follow up with saline flush again, and you're going to want to administer the same amount or more of the medication that you gave. So we gave 1 ml total, so we're going to at least do 1 ml with our saline flush. And the same method, push, stop, for the 2 minutes. You want to give it over the same amount of time as well. So you push, stop, and once it's all the way in, you will clamp your line, remove your saline flush, and at this time you will talk to your patient about potential side effects with any medication that you give them. Tell them, of course, to call if they have any questions or any concerns. And then you always want to reevaluate your patient for therapeutic effect to see if the medication is working or not. This concludes the IV push video.